Today we are gonna look at the difference between a screw retained full arch prosthesis versus Smileloc full arch prosthesis, how they are inserted, the final delivery, and how it is different. Let's get to it. So I have two examples here. This is a case which is screw retained. This is another case which is Smileloc, no screws. Let's open these. So if you look at this one, we have all the screws, screw holes. And if we look at this one, no screws at all. So how is it different, the delivery? Here we go. So we have the models, so that we don't have the patients, but we made some models, so we can use these. To deliver, to insert this screw retained prosthesis, we are gonna need all of these. So what do we have here? I'm gonna put the Smileloc aside for now. We're gonna look at this and we are gonna time it. So we're gonna see how long it takes to deliver, insert a final screw retained prosthesis versus Smileloc prosthesis. Okay, so we need to have some instruments. We have to have the implant kit, and now of course we need screws, and then we need our composite gun with some composite, and then we need this sealer material that we apply to the top of the screw, so that when we put our composite, the filling material that fills the holes, so that it doesn't go all the way to the tip of the top of the screw, so it doesn't create a problem later on. Okay, let's start. This is real time. You still have to do all of this. Okay. Open our instruments. We open our screws. Okay. All right. We have our prosthesis. We put it on the model, as if we are inserting in the patient's mouth. First, then we have to screw it. We open our kit. We get our screwdriver, and then we start screwing. This particular case has only 4 implants and 4 screws. So we fasten one gently. We don't fasten all the way down. We just let it connect. Then we go to the back. Again, initial engagement. That's it, nothing more. And then we go to the other side. So we try to put these screws in. If you're using screw retained, like, you have to be very careful how you fasten this. You can't fasten one screw all the way down and then go back and try to put the other ones. Then it's not going to be balanced. Now all my screws are in. Now I go in and try to balance them. Be very careful when I screw these in. Now let's go one more round. Front, back, the other side, and the other front. Now then we are gonna use our torque wrench, and I'm actually going really fast here because I don't have to deal with the tongue. I don't have to worry about anything, the cheeks. So this is going quite fast. Okay, so all the time we have to make sure that we do the final torque of these screws. Whatever implant system is being used, the manufacturer's recommendation. Here for this one, we have 15. So we are gonna go and torque these to 15. It's the prosthetic screw that we are doing. Okay, now we are done with this. Now next we have to make sure that we cover the top of the screw head. So I'm gonna have a little 4 little pieces of this material here. Okay. We are going to roll them. We are going to put them in. Plug it in real quick. Next one. Goes in. Next one goes in. I'm trying to do this as efficiently as possible. Again, here in this demonstration, I'm not dealing with the tongue. I'm not dealing with saliva. Okay. Please let me know if you guys have any questions about how this works after the video in the comments. We'll be happy to answer all your questions. Now we covered the top of the screws, and now we are going to apply the composite. Clean it up because I am going to make sure it's nice and smooth, because we don't want these to be high. Then we have to come back and actually adjust the occlusion if these are high. So it's very important to make sure that they are filled out really nice and flush, and then we cure it. I know even this doesn't look like it's long, but it does take time, right? Every second counts in the dental chair. Patients, they do not want to stay in that chair if they don't have to. I'm just doing one round, but we usually like to do more than one to make sure that composite is fully cured. Well, let's do that. Sometimes if the composite is not fully cured, the patients, they may just leave, and then like, oh my God, I went home, and as soon as I went home, the plug came out, and then they have to come back the following day. Or if they don't have time, that area stays without any plugs for, I don't know, whenever, a week, 2 days, 3 days. And that is gonna be so uncomfortable, because the tongue will always want to play with that edge. Or sometimes patient even may think like, oh my God, my tooth broke, where it's just the filling, the filling material that is used to cover the screw access hole. Okay, now we are done. I'm gonna go back and then see how long it took. I don't know exactly, because I don't know. I haven't watched the video yet. Now let's put all these aside. So now we have our screw retained prosthesis. Let's clean this area. Okay, we have this. Now it's time to insert our Smileloc prosthesis. Now let me show you, like I said, this one has no screws. Now this actually has 6 implants underneath, so this one had only 4. So we are gonna compare how long it took me to insert a full arch All-on-X, screw retained full arch All-on-X on 4 implant versus a Smileloc full arch All-on-X on 6 implants. You ready? Here we go. Done. Took me really little. You can look at it, it's perfectly sealed. Because this is a locking mechanism and this is not gonna come out. You can see everything is fully sealed and seated perfectly. And there you have it. So I'm gonna go back and check how long it took and I'll let you guys know, but you guys can watch the video and then tell me how long it took. Here we go. Screw retained 4 implants only versus Smileloc 6 implants. Thank you for watching.